Yeah, hello dear people. Here we are again with our video series about conditions which can be treated with the Buteyko method. And today we want to talk about snoring. So we both had a lot of students. You had a lot of students who snored, and me myself also, not so much as you, but also a quite decent amount of people. And the Buteyko method works really good with people who snore, in my experience, and probably in yours too. So, can you explain a little bit what people can expect when they snore and do the Buteyko method?
Yeah, first of all, I don't remember any of my students who would come specifically for snoring problems. So people would rather complain about fatigue, maybe some other health conditions, which might be asthma, heart disease, and so on. And snoring can be just an additional factor which is present for a lot of people. And the reason quite simple, because what happens when people have chronic health problems and they get more and more sick, people get sicker, more severe forms of disease, more severe symptoms starts to develop. Snoring is one of them because breathing gets heavy, and that's manifested again in terms of having bigger minute ventilation during sleep.
Sure.
And that what happens next here is different muscles become tense because of low CO2, and also airways get constricted. So there are various negative effects. So for some people, it starts to manifest itself in terms of having snoring and more loud snoring during sleep. So the solution that we take for our technique is to slow down our automatic unconscious breathing. Because if we think about what should be normal breathing or healthy breathing during sleep, it would be totally noiseless, quiet, very relaxed, around 10-12 breaths a minute only. This is how it should be according to any medical textbook. If you open would say 10-12 breaths a minute, only 4, 5, 6 liters for minute ventilation, liters of air going on, because people with snoring would have 12, 15, maybe 20 liters of air, meaning a lot of airflow going out. But negative effects here are very vast because people get less oxygenated in cells and tissues of the body. And that causes long chain reaction, like abnormalities related to immune system, related to nervous system, cardiovascular, digestive, so a lot of other abnormalities can appear. And therefore, when people start to slow down their breathing, it requires breathing exercise, to do physical exercise, lifestyle changes. So our goal is to slow down breathing. When people start to slow down their breathing, their snoring gradually starts to reduce. How much we snore throughout the night would be less and less, how loud it is would be less and less. And at a certain point, usually takes somewhere around 30 seconds for the morning body oxygen test. I don't remember any of my students who would say, like, I already have 30 seconds for the body oxygen test and I still have snoring. That probably, I don't know, maybe there might be like among thousands who was treated by Dr.
Or if you drink or eat a lot in the evening, and for one day maybe it will reappear, I don't know.
But that would be accompanied by heavy breathing, not 30 seconds. 30 seconds was it's a really high result because it's not actually yet the norm, 30 seconds, because people with snoring usually start with 10, 15, rarely maybe 20 seconds, around 20 seconds for the body oxygen test, meaning that we breathe at least twice the norm. And then we start to slow down the breathing. This is the main purpose of the technique, to slow down our unconscious automatic breathing by relaxation, kind of meditation type of breathing exercise, or people can use devices, different techniques are possible. Lifestyle changes, physical exercise, we address sleep, diet. With this program, when we start to slow down our breathing, it's I would say probably 2, 3, 4 weeks time would be very common when all snoring disappear in all students. And that means it can happen at different levels. Some people may need 20, but 25, 30 seconds is usually enough. And that's a great result because it does not require any additional techniques, methods like chin straps and so on. People just can achieve good results. Having like if we have CPAP, maybe sleep apnea, other conditions to use the machine. So it's a great natural remedy, great technique. Plus, in addition, what is great about this technique, it's not just we address a snoring alone, and that's again, like I say, already mentioned, not the main condition people come with, but it allows to solve many other health related effects, such as people get much more energy, sleep is dramatically improved, people's sleep gets much shorter, especially if people get 30, 40 seconds, really good results for the body oxygen test and the breathing retraining. plus mind focus ability, concentration ability of people to do different type of work during the day greatly improved. And symptoms related to other conditions, related to nervous, digestive system, related to maybe high blood pressure or blood sugar regulations, like whatever we have, these abnormalities also start to disappear with breathing retraining. So that's a really nice solution, easy. I would say not too easy because people need to practice, but totally natural and provides a lot of long-term benefits. So that with breathing retraining we can address this kind